with acne scarring, dermatologist Lisa Kellett is here with effective treatment options. Please welcome Dr. Lisa Kellett.
Thank you.
I don't care how old you are, we're going, why do we get acne? Why does that happen?
So it's multifactorial, increase in oil production, a problem with the cells as they clear out from the duct, and also some hormones.
And why do we get scarring from it?
You know, acne is a very inflammatory process. There's lots going on in the dermis, which is underneath the skin. And when that happens, you get so much inflammation that it starts to pucker the skin and pull and tether the skin down, and you get the pock marks and the ice pick scarring.
So can you prevent scarring? Can you do that?
There are a couple things. I mean, what you should do is you should avoid picking. No picking, no prodding, and no extractions.
Okay. Because
that
just damages the skin.
Absolutely,
completely.
yes.
Okay, and then we're going to talk about some product over here. Did you want to talk
about
about
that?
that?
So a couple things.
Yeah.
So just in terms of how to treat acne, no creams, no lotions, no oils, and no liquid foundations.
Really?
Okay, those all make you more prone to breakouts.
Okay. So what do you do?
So, simple things. So the first thing is how to cleanse. Okay? So find something that's an exfoliating cleanser, gel, and has exfoliating beads in it. Nothing too harsh, nothing too foaming. And what you do is you have to properly use it. That way, you can exfoliate at home.
Okay.
Okay.
And is it every day that you do this?
You can do it once to twice a day, depending on how sensitive you are. So you're looking for something that's like this, and as you can see, it has some beads in it.
Yes.
So it's going to exfoliate, and you can do that at home.
You're not rubbing hard.
Just in circles.
Right.
And you can start to exfoliate at home, as opposed to using something very harsh or picking or prodding.
And you'll see a difference probably within the first week, I would assume.
Absolutely, because it helps you get rid of dead skin cells. So that's the first thing. Step number 2 is to properly use the topical. So you can start with the topical benzoyl peroxide, but the key is how to use it. And what you do not use spot treatment. So for acne, if you treat the spots, you'll treat the spots, but you don't prevent anything from happening.
I see.
Right, you want to prevent it. So what do? So take something like a benzoyl peroxide. You take the size of a pea, and you put it on your finger. That pea is for your whole face. So take this, dab this on the forehead, nose, chin, cheeks, for adult females underneath the jawline as well. You dab, and then it's like connecting the dots. Then you rub it in. That ensures you won't use too much, so you won't get too irritated, but you're still preventing it. Because you want to treat the skin that's not only affected by acne, but treat the skin that is not, because then you'll prevent it.
Okay, very good.
Yes.
Now, you're all going to go home with polishing cleanser from Clear Clinical. So acne can be very hard on your self-esteem. One viewer wrote to us for Dr. Lisa's help with her scarring. Watch this story.
Hi, I'm Christy, and I've had a hate-hate relationship with my skin. I've had acne problems since I was about 22. I've only had pimples here and there when I was a teenager, and then all of a sudden it just became terrible. I had super intense cystic acne all across both cheeks. You could barely even see my skin underneath the pimples. So to alleviate this problem, I actually tried a lot of toners, I used cleansing creams, I used soaps. I've used basically everything that was topical, anything I could buy at a drugstore that promised me relief. I've tried elimination diets, which somewhat decreased the acne, but it never got rid of it altogether. What finally worked for me was a popular prescription medication for acne. I finally had relief. However, I was left with all of the scarring from said acne. So the scarring does make me feel more insecure because it's definitely harder to introduce myself to people without noticing that they're looking at my skin. I think people do probably get this impression that I'm either dirty or lazy with my skincare, when that is absolutely not the case. I am beyond excited to meet Lisa now that I'm about to get treatment.
Hi there, how are you?
How are you?
Nice to see you.
Nice to see you as well. I think she's going to do absolute wonders for my skin, and I just cannot wait to start the process.
Well, let's get started. Perfect. Get after you. Okay, so in terms of your examination, you do have atrophic scars. In terms of Christy's skin, my first impression is that she has significant atrophic scarring. Some of them are actually quite deep. My area of expertise is scars, so I like to work with different technologies and figure out how I can get the maximum improvement for that patient. So the first thing we're going to do is get you to lie down, and we'll cleanse your skin. The management plan for Christy includes 2 treatments. The first treatment is something called eDermaStamp. We'll get you to look this way. Perfect. The first thing we do is we cleanse the skin, and it's very, very important to cleanse properly. Alcohol is not adequate for cleansing, so we use something called chlorhexidine. It's basically able to kill all the bugs that would be sitting there. The second step is to put a topical freezing on. Most patients with the eDermaStamp treatment feel absolutely nothing. They might feel a little bit of roughness on their skin, but most patients describe it as very pleasant. It's a very comfortable treatment. By using the microneedles, we cause micro-injury to the skin, and that whole process causes the regeneration of new collagen. The end result for her will be that her scars appear smoother, they're less indented, and the appearance is better. Okay, so we are finished. So step 1 is done. The second treatment that we've chosen for Christy is something called Restylane Skin Boosters. And what it is, it's a form of hyaluronic acid. It's a specific treatment because the syringe is a measured syringe. It is able to deliver 0.01 cc's of product per click. So by injecting it underneath the skin, we're able to cause an improvement in the smoothness, appearance, and elasticity of her skin. We're finished.
Oh my gosh, already.
Up to 99% of the population will have some type of acne in their lifetime. So on average, with the eDermaStamp, you're looking at 3 to 4 sessions in total. In Christy's case, her clinical care will be challenging. Then with the Restylane Skin Boosters, we do 3 sessions, 1 month apart. But I'm up for the challenge, and I'd really like to get her a great result.
Okay, great. Thank you so much,
My
Doctor.
pleasure.
That is awesome. So, Lee, yeah, really good. So how did it all go, and how many treatments did she have?
So she had 3 sessions, both of eDermaStamp and Restylane Skin Boosters.
Very good. Okay, we got to see Christy. Let's see it right now. Come on in, Christy. Oh, beautiful. Come on in, sweetheart. Look at you. Wow, you look awesome. You look awesome.
Thank you.
Boy, how do you feel?
I feel absolutely fantastic. I can't stop looking in the mirror. I just feel like my old self. I feel super confident.
Great.
I just love it.
When did you first see a difference? When did that happen?
For me, the very first treatment.
Really?
I honestly, as soon as I got home.
Okay, we have to see it before and after. We have to see it before and after. I'm so happy. I'm so happy. And I want to say thanks to Chevelle Salon for your cut and color, and Cellar Salon for styling your hair today. And I can see that you pulled your hair back so you can see your beautiful face. I love that. So it's really good. So Dr. Kellett, what does she have to do now to maintain this?
So we want to make sure that her acne stays clear. So the things we talked about earlier, no creams, lotions.
Right.
And also in
Are you finding product to be able to manage all of that?
Absolutely,
Okay,
from
yeah.
Dr. Lisa.
Okay.
Yeah, and a benzoyl peroxide as a preventative therapy.
Very good.
Yeah.
Well, happy holidays to you.
Thank you.
You're rocking it. Thank you, Dr. Kellett. Thanks, everybody. We're going to take a break. We'll be right back. You look great.